Hi, I'm Jerry and I'm the Digestive Health Specialist. Continue on with our conversations about gluten. Where do you find gluten? Well, it's in a lot of baked products, particularly breads, but also pastas, cereals, crackers, beer, canned soups. The list goes on and on and on. Why do they put gluten in these things? Well, it adds flavour to it. It uses a moisture retention agent, and it also creates a more texture in the food. So they use it in the foods to make it more appealing, or for specifically in baked things, for them to be able to have the volume. So the problem with gluten is that it creates a mild inflammation because it's a type of poison. So what it can do, it can create inflammation in your mucosa, which is the absorption of cells around your digestive system, which can increase something called zollulin. And zollulin leads to leaky gut syndrome. So leaky gut syndrome is where particles of food are able to bypass the normal channels and get into the bloodstream that are bigger than the bloodstream normally would cope with. So it causes a reaction, and they name this leaky gut syndrome. So gluten can cause inflammation, which leads to things like headaches, brain fog, lethargy, rashes, IBS, and the list goes on and on and on. So how can we test for gluten? Well, you can do a blood test. You can do a biopsy of the small intestine as well. Or you can try just eliminating gluten from your diet if you have any of the symptoms that I talked about before. And if those symptoms start to lessen, then you probably are gluten intolerant, in fact, that you have a sensitivity. So it doesn't really take very long, maybe 2 to 4 days, if you excluded gluten from your diet, to see whether you have any regression in any of those symptoms. Hope that helps. Stay safe. Bye.